Well, I think my thing's a little different than John's because I'm not doing extensive interviews because I'm not doing physical therapy. The approach that I take, I mean, it's real clear to me that where my job ends, where that line is to refer someone and not get into any psychological stuff myself because I haven't been trained and don't feel adequate doing it. But what I notice is people will start to, they'll come in for some spasm or something. So what I'll do is just approach it from a physical level. I want you to start noticing when you're sitting at your desk what you're doing with your shoulders. I want you to start noticing how you're walking. You know, if you walk by a window or a mirror, are you doing this? You know, what's happening in your body? And what generally will happen is a few weeks will go by and they'll come in and they'll say, God, you know what happened? My boss walked into my office and I just went like this. I could feel. So they'll start connecting the emotion with the physical stuff themselves.
Right.
And then
that's good.
And then end up, you know, looking at, oh, how am I holding it? And if they obviously have like heavy psychological problems, I don't know, I've actually never referred someone to counseling. I sometimes have talked about my own therapy as kind of an encouraging thing.
I know your client's basically under psychological evaluation.
We get people through a pain clinic where they have a lot of history and they're real chronic. So those particular people, they're in sort of a population of all their own, and that might be 10% of our clientele, just because a pain clinic is referring to our clinic. But the rest of the people are just, you know, referred through the psychological component. Of all the patients I see, probably 60-70% would have a psychological component.
Seems high.
Yeah. And then somebody asked me the other day, how many people do you think are contributing to their problem or don't want to help themselves? And I said, probably 40%. But then that seemed high, and I thought, well, it's really people that I feel that aren't taking, it's not that they don't want to get better, they're not taking the advice from professionals, and they're not grabbing the reins and taking their lives under their own control. So a lot of, I think, psychophysical problems comes from childhood and upbringing, how much control those people had in their lives. You know, you can call it being victims or anything if they were really under a lot of abuse. People with a lot of chronic problems, like these pain clinic patients we see, have histories of child abuse, sexual abuse, any kind of abuse, and that's a large percent of those people with chronic problems that have those histories.
That's interesting.
But then, what about the people that maybe haven't had that kind of abuse, but have they been able to take their lives and make them what they wanted to? And so if they can't do that with their lives, they can't really do that with their pain. And so a lot of it is instilling in them how much they can observe in themselves like that, like you said, and how much, how much they can in small ways begin to take control of their pain, their problem.
Yeah, because you can't come out and hit somebody with a baseball bat who's in that space and say, you know, you're not doing anything about this.
Not early on, but you certainly can later on. And there's some people I tell that to. Hit them over the head with a baseball bat.
After
tell them
you've seen
what
it.
I think. Yeah. Because I don't like to talk to the doctor and tell them all kinds of things that I wouldn't tell the patient. I like to feel that I'm telling both pretty much the same.
How long do you think it takes to realize a change on a physical level that ends up as a change, a real behavioral change? I mean, what are some of the indications you've...
Changing posture, maybe dropping the shoulders, change in alignment of the neck. think it just comes from noticing what your habits are now.
You know what I'm really noticing? It seems in my life I just